Dr. Priyanka Batra. I am Senior Consultant in the Department of Gynae and Gynae Oncology in Medanta, Gurugram. How to diagnose a cyst? Let's understand how we can diagnose an ovarian cyst, because ovarian cyst has a very long spectrum. It may varies from a simple physiological cyst for which we don't need to do anything, and it may have certain suspicious cancerous cyst also. So diagnosis of a cyst is the most important thing to know how we will treat the patient. So to diagnose a cyst, first we examine the patient in detail and we take the detailed history. In history, there are certain points how rapidly that cyst has come. If there is previous any investigation, ultrasound, then we compare the cyst to see whether the cyst is rapidly growing or it is slow growing. Then we examine the patient thoroughly. We do pelvic examination, in which we examine the local areas of the patient, and we do complete per abdomen examination and pelvic examination of the patient, and we try to look for any size of the cyst, its mobility, its firmness, whether it's solid or no. So doctor has to see all these features in detail. And then we make our diagnosis. We corroborate it with few blood tests and imaging studies. In imaging, first line ultrasound is transvaginal ultrasound. Transvaginal ultrasound is done by a radiologist through the vagina, in which we look for the size of the cyst, the nature of the cyst. They have certain, the radiologist doctor have very much criteria on the basis of which they see whether there are any solid areas, whether there are septas, whether the cyst is single cyst or it is multiloculated cyst. These features are important to diagnose whether the cyst is suspicious or benign, or it has certain cancerous elements or no. If on the ultrasound we find that there are certain suspicious areas, they can put certain blood flows also in the while doing the ultrasound. And if we find that there are certain suspicious findings, then we go for very good investigations, which is MRI. MRI study is a study in which we see all the pelvis, lower abdomen and even the upper abdomen in detail. That will tell us about the nature of the cyst, and if the cyst is there, how big is the cyst, whether inside picture of the cyst is very clear, and it is almost confirmatory for diagnosis, and its sensitivity and specificity of diagnosing a cyst, ovarian cyst, is very high, on the basis of which we can plan the treatment in a better manner. Then there are certain tumor marker tests or blood tests, like CA-125 is a very common test which we do as a first line test. But we have to take care that this test CA-125 is not confirmatory for the test. This is only corroborative test, on the basis of which we just get a clue whether it is which type of cyst it may be. But the CA-125 may be raised in many other conditions. Patients come sometimes, they are very anxious because of high CA-125. They think probably they had cancer or what, but this is to be correlated with other things, because there are certain liver conditions, kidney conditions in which CA-125 may be very high. So this is not a confirmatory test for cancer, but we just corroborate it and it helps us in making a diagnosis. But nothing to worry even if it is high.